Hey everyone, and welcome back for another deep dive with us. Today we're going to be talking about something that I think a lot of us have personal experience with. We're talking about back pain and trying to figure out the very confusing world of how to treat it.
Yeah. And you are definitely not alone if you feel like you're lost in a sea of medical jargon and treatment options when it comes to back pain.
Absolutely.
And that is why we are diving deep into the insights of Dr. G. Katsevman.
Yes.
He is a neurosurgeon and spine surgeon in Florida,
Okay.
and he was generous enough to share some materials from his website. And they really get to the heart of how he approaches patient care, especially when it comes to the big S-word surgery.
Okay, let's unpack this for a second because I have to admit, when I hear neurosurgery, I don't always think conservative treatment first.
Right.
Um, but that is exactly what Dr. Katzman emphasizes, right?
Yes.
He really challenges this assumption that everyone who has back pain is, like, destined for the operating table.
Absolutely. And what's so fascinating about his approach is he actually directly addresses this. He says that most patients come to him wanting surgery,
Wow.
but most of the time they don't actually need it.
Interesting.
Which I think is just such a fascinating way to kind of flip the script on what people are afraid of.
Yeah.
You're not alone if you think surgery is the only answer.
Right.
But Dr. Katzman really prioritizes exploring all other options before even going there.
I love that. It's refreshing, right?
Yeah.
It's like, I'm not here to rush you into anything. Let's figure out what's actually going on and tailor a treatment plan that makes sense for you.
Yeah.
And speaking of figuring out what's going on, he's got a really thorough approach to diagnosing back pain, right?
Yeah.
It's not just, okay, like hop in the MRI machine, we'll see what's up. He really emphasizes, like, listening to the patient's story. Where's the pain? When does it flare up? What makes it better or worse?
Yeah.
All of those details that I think sometimes we as patients were like, oh, they don't need to know that. That's not relevant.
Yeah.
But actually, it really is.
Absolutely. It's like putting together a puzzle.
Yes.
And your experience is that key piece.
Yes. I have a great story about this. So one time I went to the doctor and I had this like weird pain in my arm. And it turned out to be totally unrelated to like anything I thought it was going to be. It was all about how I was sitting at my computer. Like completely different part of my body. And so paying attention to those details, I think, can make a world of difference.
Absolutely. And once he's really gathered that detailed history from you, then he goes into a thorough physical exam as well. He's checking for things like muscle weakness, reflexes, areas of tenderness, all of those clues that help paint a clearer picture.
Yeah, it's like he's a detective. But instead of like, looking for clues at a crime scene, he's piecing together like the story of your back pain. And it's only after that deep dive into your history, your physical exam, that he brings in any sort of like targeted imaging, right? We're talking MRIs, CT scans, even those really cool like dynamic x-rays that show how your spine moves when you bend and stand, things like that.
Yes. And something that he actually says on his website, he uses this phrase, what is causing the pain?
I love that.
And that is really the driving force behind his entire diagnostic process. And I think that's what's so powerful about that is it really highlights his commitment to finding the right treatment, not just slapping a Band-Aid on the symptoms.
Yeah, it's that whole patient-centric approach shining through, which I love.
And this actually leads us perfectly to another area where I think Dr. Katzman might surprise you.
Okay.
He's a huge proponent of conservative care.
Interesting. Okay.
And this is where things get really interesting because we're talking about a neurosurgeon who specializes in spines, right? But he is a huge proponent of exhausting all of those non-surgical options before even considering surgery.
Which makes sense, right?
Yeah.
When you really think about it. Like, surgery should be the last resort, not the first line of defense.
Exactly.
But I think a lot of people, I mean, I'll admit, I think this way sometimes too, where it's like, oh, back pain. Like, that equals surgery, right?
Right. And that's where I think having access to this kind of information is so powerful because you start to understand that there's this whole world of options between do nothing and go under the knife.
Totally. Okay, so what kinds of conservative treatments are we talking about here? Give us the rundown.
So we're talking about a whole range of treatments that are really tailored to your specific needs. Dr. Katzevman mentions things like, targeted physical therapy, a variety of different medications to address both pain and inflammation, and then also different types of injections that can provide relief as well.
Yeah, and I appreciate that he doesn't just kind of like gloss over the medication part. He actually gives examples. He's like, we've got nerve pills, we've got muscle relaxants, we've got anti-inflammatories. It's not just like a one-size-fits-all approach. He even talks about like finding the right medication dosage and combination to really manage pain effectively.
Exactly. And I think that's where that patient-centric philosophy really shines through again, right? He's not just throwing medication at the problem. He's working with you to find what is going to be the most effective way to manage your pain while also minimizing any potential side effects.
Totally. Okay, so this is all really good news, right?
Yeah.
For those of us out there who like shudder at the thought of surgery, but I'm guessing there are times when it is the best course of action.
Mm.
So how does Dr. Katzman decide when conservative care just isn't enough?
That's such a crucial question, and one that I think a lot of listeners are probably wondering about, right?
Yeah.
And while Dr. Katzman is very clearly passionate about exploring all of those conservative avenues, he's also realistic, and he does outline a few key scenarios where surgery might be warranted.
Okay, so walk us through those. Like, when does he actually make that call?
So one of the main triggers is persistent pain that just doesn't respond to conservative treatment.
Okay.
So like we were saying earlier, he really encourages patients to exhaust all of those non-surgical options first. We're talking physical therapy, medication, injections, like the whole 9 yards.
Yeah.
But if you're still dealing with significant pain after giving those a fair shot,
Right.
it's a sign that something more might be needed.
Yeah, which makes sense. You don't want to jump into surgery prematurely, but you also don't want to suffer needlessly if there's something else out there that could potentially provide relief.
Exactly. And it's not just about the pain level itself either. Dr. Katzevman also mentions that, like, experiencing weakness or concerning neurological symptoms would be kind of like red flags as well.
Okay, so let's break that down a little bit. Like, what kind of symptoms are we talking about here?
Yeah, so we're talking about things like, you know, loss of balance, difficulty with coordination, changes in like hand dexterity, things like that.
Gotcha.
These are all symptoms that could suggest potential nerve involvement,
Right.
which can be a sign of a more serious underlying issue that might require surgical intervention.
Okay, and that's where I imagine a lot of people start to get nervous, right?
Oh, yeah.
Because back surgery in general can feel pretty intimidating, especially if you've like heard those horror stories about failed back surgeries. Like, how do you know?
Absolutely. And this is something that Dr. Katzevman doesn't shy away from addressing those fears at all.
Okay.
He really emphasizes that a big part of, avoiding those negative outcomes, it comes down to like three main things.
Okay.
Number one, having a correct diagnosis.
Okay.
Number two, making sure that you're choosing the most appropriate surgical procedure for your specific situation.
Right.
And then, of course, number three, surgical skill.
All right, so it's not just about like finding a surgeon who's good with a scalpel. It's about finding someone who takes that really holistic approach,
Yeah, exactly.
understands your individual needs, and then have the expertise to like choose the best course of action.
Yes, precisely. It's about having a surgeon who sees the big picture and who prioritizes like your long-term well-being.
Totally. And speaking of big picture, let's talk about Dr. Katzevman's actual approach to surgery, because he seems to be a really big proponent of these like minimally invasive techniques and motion preservation. Can you kind of explain what those are and why they matter?
Right.
So minimally invasive techniques and motion preservation. I mean, those sound like, kind of buzzwords, but I'm guessing they have a huge impact on patient outcomes.
Oh, absolutely. And I think they speak directly to those fears we were just talking about, right?
Oh, great.
So minimally invasive techniques are all about minimizing the trauma of surgery. So instead of these big, long incisions, imagine like tiny little cameras and these specialized instruments that are working through very small openings. So less cutting, less scarring, quicker recovery time. That's what I'm hearing.
Exactly. Shorter hospital stays generally, less post-operative pain, lower risk of complications.
Right.
It's a win-win.
Nice. Okay.
And then there's this motion preservation aspect, which is really interesting. Dr. Katzevman seems to be a big advocate for avoiding spinal fusion whenever possible.
Now remind me, why is that a good thing? Because I know, like, fusion is a really common procedure, but what are the downsides there?
So fusion, it does provide stability,
Okay.
but it comes at a cost.
Okay.
So it basically involves permanently joining two or more vertebrae together,
Okay.
which, while that does provide stability, it can also limit your flexibility and range of motion in that area.
So you might be pain-free, but you also might have lost like, a significant amount of your ability to bend and twist, which
Yeah.
could impact your daily life in a big way.
Exactly. And Dr. Katsevman seems to be very, very aware of that. He talks about exploring, motion-preserving alternatives, so things like artificial disc replacement.
Or doing what's called a decompression surgery without fusion whenever it's appropriate.
So it's really about, like, choosing the option that gets you back to doing the things that you love without, like, sacrificing your mobility down the line,
Yes.
which makes so much sense.
Exactly.
And it, again, goes back to that patient-centric approach that he seems to really prioritize in everything he does.
Yes, and he even utilizes some really cool technology to achieve these goals. Remember that bone knife we were talking about earlier?
Yes.
Sounds kind of intense, but it's actually a really great example of how technology is leading to better patient outcomes.
Okay, refresh my memory. How does this bone knife actually work?
So it's not actually a knife in the traditional sense.
Okay.
It actually uses ultrasonic waves to cut through bone with this incredible precision.
Yeah.
So it minimizes damage to the surrounding tissues, it reduces bleeding. It's like kind of sci-fi movie stuff.
That's wild. I'm curious, have you seen this kind of technology being adopted by a lot of other surgeons? Because this sounds incredibly, like, cutting edge, no pun intended.
Yeah, definitely. It's becoming increasingly common, especially among surgeons who specialize in these minimally invasive spine procedures.
Right.
And it's not just about, fancy tools either. He also emphasizes the importance of that human element as well, like having a dedicated team for neuromonitoring during the surgery to
Yeah.
make sure that everything's going smoothly.
It's reassuring to know that he's not just relying on the tech alone.
Right.
It's that combination of, like, those advanced techniques, but also that, like, real personalized care that seems to make his approach pretty unique.
Absolutely. And it doesn't end in the operating room either.
Right.
He's very, very clear about the importance of a really comprehensive post-operative care plan,
Okay.
which might include things like, we've got physical therapy again, different pain management strategies, even things like collars or bone stimulators to help aid healing.
So it's a journey. It's not just like a quick fix.
Exactly.
He's there with you every step of the way, from like diagnosis to recovery.
Precisely. And I think throughout that whole journey, he really emphasizes the importance of open communication and patient education.
Yes.
He wants his patients to really be active participants in their own care, armed with the knowledge that they need to make informed decisions.
Which is so important. When you're dealing with something as complex as, like, back pain, feeling informed and empowered can make all the difference.
Absolutely.
So what does this all mean for you if you're listening to this and you're dealing with back pain? Take a page from Dr. Katzman's book. Be proactive, get informed, don't be afraid to ask questions.
Exactly. There's this whole world of treatment options out there, and the right approach for you might be different from what you expect. Knowledge is power, and Dr. Katzman's insights really give you that great starting point on your journey to finding relief and getting back to living your best life.
That's all the time we have for today's deep dive. Thank you so much for joining us, and we will see you next time.